There is a phrase that I have heard spoken in examination rooms, hospital corridors, and outpatient clinics more times than I can count. It goes something like this. Well, you're getting older. This is just part of aging. And for 30 years, I have watched patients nod quietly, accept this explanation, and walk away believing that the fatigue in their bones, the fog in their minds, or the weakness in their legs is simply the price of living long enough, that nothing can be done. That decline is inevitable. But here is what I want you to understand, right from the beginning. That statement, "This is just normal aging," is often profoundly incomplete. And in many cases, it is simply wrong. Now, I want to be careful here. I am not suggesting that aging is a myth, or that you can live forever, or that doctors are lying to you. Aging is real. The body does change after 65. But here is the critical distinction that too many physicians fail to make. There is a significant difference between biological aging and preventable functional decline. What I mean by that is this. When your muscles weaken, when your thinking slows, when your energy disappears, these are not always signs that time has caught up with you. Sometimes they are signs that something specific is going wrong, something that can be addressed, something that, with the right understanding, can be reversed. And that is what we are going to talk about today. Not miracle cures, not anti-aging gimmicks, but a series of commonly dismissed symptoms that are labeled as normal aging, but are, in fact, correctable mistakes. Physiological responses to behaviors, habits, environments, or nutritional gaps that your body can no longer tolerate the way it once did. This is not about defying nature. It is about respecting what your body actually needs after 65, and understanding that many of the changes you have been told to accept may not be age at all. They may be adaptation failure, and adaptation failure can often be fixed. Let me explain what I mean by that term. Adaptation failure. When you were younger, your body had what we call physiological reserve. Think of it like a buffer zone. If you did not sleep well for a week, your body adapted. If you ate poorly for a month, your metabolism adjusted. If you stopped exercising for a season, your muscles bounced back relatively quickly. Your system could absorb insults, recover from deficits, and maintain function even under suboptimal conditions. But after the age of 65, that reserve begins to shrink. This is well documented in the gerontological literature. A landmark review published in the Journals of Gerontology described this as homeostenosis, a narrowing of the body's ability to maintain internal balance under stress. The buffer is smaller. The margin for error is thinner. And here is where the problem arises. The same behaviors that were tolerated in your 40s and 50s, inconsistent sleep, sedentary routines, nutritional gaps, chronic low-grade stress, now begin to produce symptoms. Your body can no longer compensate silently. It starts sending signals: fatigue, weakness, confusion, instability. But instead of recognizing these as signals of mismatch, signs that something in your environment or habits no longer fits your physiology, many physicians interpret them as simply aging. They see your date of birth, they see your symptoms, and they connect the two without investigating further. This is where most people get misled, because what looks like irreversible decline is often, in reality, reversible mismatch. And once you understand that, everything changes. Let me walk you through the first major category where this misunderstanding causes real harm, and that is fatigue. I cannot tell you how many patients I have seen, intelligent, capable, vibrant people, who come in and say, "I just don't have the energy I used to have. I'm tired all the time. I suppose it's just my age." And yes, fatigue can be associated with aging. But here is what many people do not know. Research published in the Journal of the American Geriatric Society found that nearly 40% of older adults who report persistent fatigue have an identifiable, treatable cause. Not vague aging, a specific cause. Let me give you an example. I had a patient, I will call her Margaret, 71 years old. She had been an active woman all her life, gardened every weekend, walked 2 miles a day. Then, over the course of about 18 months, she became profoundly tired. She could barely get through the afternoon without lying down. Her previous doctor told her, "Well, you're in your 70s now, this is normal." When I saw her, I ordered a complete metabolic panel, a thyroid function test, and checked her vitamin B12 and iron levels. What we found was striking. Her vitamin B12 was severely low, not just borderline, but genuinely deficient. This is something that becomes more common after 65 because the stomach produces less intrinsic factor, the protein necessary for B12 absorption. Within 6 weeks of B12 supplementation, Margaret was walking again. Within 3 months, she told me she felt like she had gotten 10 years back. That was not a miracle. That was not experimental medicine. That was simply identifying a correctable deficiency that had been dismissed as normal aging. Now, I am not saying everyone with fatigue has a B12 deficiency. What I am saying is this: fatigue after 65 deserves investigation, not resignation. Thyroid dysfunction, anemia, sleep apnea, medication side effects, low-grade infections, even depression. All of these can cause fatigue. All of these are treatable. None of them are normal aging. If you have been told your tiredness is just what happens when you get older, I would encourage you to ask your physician for a thorough workup. You may be surprised by what they find. This brings me to the second reversible mistake, and this one affects nearly every person over 65 to some degree. It is the loss of muscle mass and strength, a condition formerly known as sarcopenia. Here is what the research tells us. According to data from the National Institutes of Health, adults begin losing muscle mass at a rate of approximately 3 to 5% per decade after the age of 30. But after 65, this loss accelerates, and the consequences are severe. Reduced mobility, increased fall risk, lower metabolic rate, greater difficulty recovering from illness or surgery. And yet, when patients report feeling weaker, many doctors say, "That's just part of getting older." Here is the part no one explains. Muscle loss after 65 is not purely a function of time. It is heavily influenced by 2 factors: protein intake and resistance activity. And the research on this is remarkably clear. A study published in the American Journal of Clinical Nutrition found that older adults require significantly more protein per kilogram of body weight than younger adults to maintain muscle mass. Yet most people over 65 actually consume less protein, not more. Their appetite decreases, they eat smaller meals, they avoid meat because of digestive discomfort or dental issues, and slowly, their muscles wither. But here is the hopeful part. That same research showed that when older adults increased their protein intake to approximately 1.2 grams per kilogram of body weight per day and engaged in even modest resistance exercise, muscle loss slowed dramatically. In some cases, it reversed. I think of a patient named Arthur, 78 years old, former accountant. He came to me using a walker, convinced his legs were simply giving out. His previous physician had attributed his weakness to age. But when we reviewed his dietary habits, he was eating less than half the protein he needed, and he had not done any form of strength training in over 20 years. We worked with a physical therapist and a dietitian. Within 4 months, Arthur was walking with a cane. Within 8 months, he was walking independently. He gained visible muscle. His posture improved. His confidence returned. This isn't aging. This is adaptation failure. And it is reversible. Now let me turn to a topic that concerns many people deeply, and understandably so. Cognitive changes, memory, clarity of thought. What people often call brain fog. There is an enormous fear among adults over 65 that any slip of memory, any moment of confusion, is the beginning of dementia. And this fear is made worse when doctors casually say, "Some cognitive decline is normal at your age." Let me be very precise here. Yes, there are certain subtle changes in cognition that occur with normal aging. Processing speed may slow slightly. It may take a bit longer to recall a word or a name. These are well documented in the neuropsychological literature and are not, by themselves, signs of disease. But here is what is often missed. Many of the cognitive symptoms that older adults experience are not caused by aging at all. They are caused by correctable factors. And if left unaddressed, they can mimic or even accelerate dementia. Let me tell you about Gerald, 74 years old, a retired engineer. His wife brought him to see me because she was worried. He was forgetting conversations. He seemed confused at times. He had trouble following complex instructions. Their local doctor had suggested early Alzheimer's and recommended they prepare for the future. When I examined Gerald, I noticed he was sleeping poorly, waking multiple times per night. He was also taking a common over-the-counter sleep aid containing diphenhydramine, an antihistamine. What many people do not realize is that medications in the anticholinergic class, which includes many sleep aids, allergy medications, and bladder control drugs, have been strongly linked to cognitive impairment in older adults. A study in JAMA Internal Medicine found that cumulative anticholinergic use was associated with a significantly increased risk of dementia. We stopped the diphenhydramine. We addressed his sleep issues with behavioral strategies. Within 2 months, his wife told me, "It's like I have my husband back." Gerald did not have Alzheimer's disease. He had medication-induced cognitive impairment, compounded by sleep deprivation, both of which were reversible. I share this not to alarm you about your medications, but to emphasize this point. If you are experiencing cognitive changes, do not accept this is normal aging as a complete answer. Ask about your medications, ask about your sleep, ask about your thyroid, your B12 levels, your blood pressure. These factors matter, and they are often overlooked. Speaking of sleep, this is the fourth area where I see tremendous misunderstanding, and it may be one of the most damaging. There is a common belief, even among physicians, that older adults simply need less sleep. That waking up at 4 in the morning and being unable to return to sleep is just how it is after a certain age. This is a misinterpretation of the science. What the research actually shows, including work published in Neuron and Sleep Medicine reviews, is that the architecture of sleep changes with age. Older adults spend less time in deep, slow-wave sleep and experience more fragmented sleep cycles. But this does not mean they need less sleep. They need the same amount, approximately 7 to 8 hours, but their ability to obtain it is compromised. And here is the critical point. Poor sleep in older adults is not merely an inconvenience. It is a direct contributor to inflammation, cognitive decline, immune dysfunction, and even cardiovascular disease. A study in The Lancet found that chronic sleep deprivation in older adults was associated with a 24% increase in mortality risk over a 10-year period. Yet when patients tell their doctors, "I'm not sleeping well," they are often told, "That's just aging," or they are prescribed a sleeping pill without any investigation into the cause. What actually helps? First, identifying underlying issues. Sleep apnea is extraordinarily common in older adults and is vastly underdiagnosed. Restless leg syndrome, chronic pain, medication side effects, anxiety. All of these disrupt sleep and all of them can be treated. Second, sleep hygiene becomes more, not less, important after 65. Regular sleep and wake times. Limiting caffeine, especially afternoon, reducing evening screen exposure, keeping the bedroom dark and cool. These interventions sound simple, but the research supports their effectiveness. I think of a patient named Doris, 69, who had not slept well in years. She assumed it was just age. When we investigated, we discovered she had moderate obstructive sleep apnea. She began using a CPAP device, reluctantly at first, and within weeks, she told me she felt more rested than she had in a decade. Her body was not declining. It was suffocating slightly every night. Once we fixed the underlying issue, her function improved dramatically. At this point, I would like to pause and ask you a question. And I genuinely mean this. How many of you watching this right now have been told by a doctor, or even a well-meaning friend or family member, that something you were experiencing was just normal aging, whether it was fatigue or weakness or poor sleep or trouble thinking clearly? Did you accept it? Did you stop asking questions? Or did something inside you feel that there had to be more to the story? I would be very interested to hear your experience. If you feel comfortable, please share it in the comments below. Tell me your age. Tell me where you are watching from. Tell me what you were told was normal, and whether you believed it. This is not just curiosity. I ask because I think there is value in recognizing that you are not alone in this experience. And sometimes, seeing that others have questioned the same assumptions can give you permission to question them too. Now let me discuss the fifth and final area I want to address today, and this is one that has profound implications for independence and longevity. I am speaking about balance and fall risk. Every year in the United States, approximately 3 million older adults are treated in emergency departments for fall injuries. Falls are the leading cause of injury-related death in people over 65. And yet, when patients mention that they feel unsteady, that they have had a near fall, or that they are worried about their balance, the response is too often, "Be careful. That's normal at your age." Here is the part no one explains. Balance is not a single system. It is a complex integration of 3 systems: your visual system, your vestibular system in the inner ear, and your proprioceptive system, the sensors in your muscles and joints that tell your brain where your body is in space. After 65, all 3 of these systems may begin to decline. But here is what matters. They can all be trained. They can all be improved. Research published in the BMJ demonstrated that targeted balance training exercises reduced fall rates in older adults by up to 40%. 40%. That is not a marginal improvement. That is a transformation. I had a patient named Helen, 81 years old. She had fallen twice in 6 months. Her daughter wanted her to move into an assisted living facility. Helen was devastated. She had lived in her home for 40 years. Her doctor had told her that falls were inevitable at her age. We referred Helen to a physical therapist who specialized in vestibular rehabilitation. She did balance exercises 3 times a week. Simple things: standing on one foot, walking heel to toe, practicing transitions from sitting to standing. Within 3 months, her balance scores had improved significantly. She did not fall again for over a year. Helen's problem was not aging. It was deconditioning and vestibular decline, both of which responded to intervention. Now, I want to be very clear about something. I am not suggesting that all decline is reversible. I am not claiming that you can live forever or that medicine has all the answers. Some aspects of aging are indeed irreversible. The lens of the eye stiffens, hair follicles lose pigment, certain cellular processes slow in ways we cannot yet fully restore. But what I am saying, and I say this with 30 years of clinical experience behind me, is that the line between reversible and irreversible is often drawn too early, too casually, without adequate investigation. When a physician tells you, "This is just normal aging," that should be the beginning of a conversation, not the end of one. You have the right to ask, what else could be causing this? Are there tests we should run? Are there interventions that might help? You are not being difficult by asking these questions. You are being an informed participant in your own care. So what is the broader takeaway from everything we have discussed today? It comes down to this. Your body after 65 is not the same body you had at 40. That is true, but it is not a body that has simply broken down beyond repair. It is a body that requires different inputs. More protein, more deliberate movement, better sleep, more careful medication management, greater attention to the signals it sends you. When you provide those inputs, when you close the gap between what your body needs and what it is receiving, remarkable things can happen. Fatigue lifts, strength returns, thinking clears, balance stabilizes. This isn't aging in reverse. This is simply allowing your body to function the way it still can, if given the proper support. And here is what I want you to carry with you from this conversation. You are not helpless. You are not at the mercy of time. You have more agency over your health than you may have been told. And while no one can promise you perfect health or endless years, the difference between passive decline and active engagement is often the difference between suffering and living well. Before I let you go, I want to say one more thing. If you found value in this discussion, if it gave you something to think about, something to ask your doctor, or simply a different way of understanding what your body is experiencing, I would invite you to subscribe to this channel. I do not make promises I cannot keep. I do not offer miracle solutions. What I offer is calm, evidence-based explanation of the things that matter most as we grow older. The kind of information I wish more patients had access to. If that sounds useful to you, I would be honored to have you join me for future discussions. Until then, take care of yourself. Listen to your body, and never stop asking questions. Thank you for your time.